Hello, everyone. My name is Emily, and today I'm going to be presenting my Financial Policy Management Project Part 2 on the budget analysis. So for my project, I went ahead and chose improving sepsis recognition through enhancing nursing education, simulation-based training, and then a little bit of use of AI. At Sunrise Hospital, we already use a bit of AI to assist us, but I feel like education along with simulation will just bring us over to the top and help us with sepsis protocols. This topic is personally important to me because I work as a bedside nurse on surgical suites over at Sunrise Hospital. And so these patients are at an increased risk of infection. Infection, unfortunately, can lead to sepsis if not caught early. So, throughout the presentation, I will be reviewing the healthcare organization budget. I'll also be identifying how patient outcomes affect financial performance. We'll discuss recommendations for budget realignment and analyze the financial impact of implementing sepsis-focused, my apologies, policy initiatives. So, before reviewing the budget itself, it is very important to understand major components that make up healthcare organization operating budgets. So the hospital spends a lot of money on their budget on salaries for employees and benefits because staffing is essential for providing patient care. Other major expenses include the medical supplies, we have medication, technology, we do have education and staff development, facility operations, and quality improvement programs. So patient outcomes directly influence many of these budget categories that we see though. So for example, when a patient experiences a longer length of stay, develops complications, or requires upgrade to an ICU admission, additional staffing, additional medication, more laboratory testing, and resources are required. This increases the budget. Patient satisfaction and HCA-HPS sources scores can also affect reimbursement and the organization's performance. When patient outcomes improve, organizations often experience lower costs, improved quality metrics, and increased patient satisfaction. This demonstrates a strong relationship between clinical outcomes along with the financial management. So the organization background of Sunrise Hospital and Medical Center. So Sunrise Hospital and Medical Center is a level 3 trauma center that provides care for both adults and children. This hospital provides emergency services, surgical services, critical care, and specialty services for a diverse population. We are in Las Vegas, so we do see a wide group. Like most healthcare organizations, though, staffing represents the largest budget expense because nurses, physicians, therapists, and support staff are all necessary to provide quality patient care. Investments in technology, support patient safety initiatives, and education improves staff competency and confidence. So quality improvement programs are another important investment because they help reduce preventable complications, also improve patient outcomes. Ultimately, when organizations invest in patient safety evidence-based practice, they often experience a better clinical outcome and lower overall healthcare costs. So yes, in the moment, it seems like they're spending more because they're having to educate. However, in the long term, patients end up having a decreased length of stay, which increases our budget or increases our outcomes. So because Sunrise Hospital is part of HCA Healthcare, I went ahead and reviewed the HCA Healthcare publicly available annual report to better understand the budgeting priorities. Unfortunately, the Sunrise one in particular, we're unable to get. So, according to the report, salaries and benefits account for approximately $32.9 billion, making the staffing again the largest expense. Much needed though. Supplies account for $11.4 billion, while other operating expenses total approximate $15.9 billion. So this demonstrates how healthcare organizations invest in maintaining operations and supported patient care. Although these figures seem large, they reflect sources required to provide better care and effective healthcare. When considering my purpose of sepsis policy, the proposed sepsis policy, improvements in patient outcomes could potentially reduce costs associated with the ICU admissions, prolonged hospital stays, and the complications that could occur. This highlights how policy decisions can influence the financial performance. So, the budget overview. So, this highlights why healthcare budgets are so important, though. Even every financial decision made by healthcare organizations can influence staffing, patient resources, and quality improvement efforts. So again, this includes the staffing, this includes physicians, operation rooms, we have technology, education programs, medical supplies, all of these initiatives and people, right, money-wise, these all work together to support patient care. So an important concept that I've learned so far during this project is that healthcare budgets are not simply about just controlling costs, but they're more so strategic tools that help organizations invest in patient safety and improve outcomes. For example, spending money on education and prevention may initially increase cost, but ultimately they'll end up saving money because the complications are being prevented along with reducing hospital utilization. So there is a direct connection between patient outcomes and the finance. So when patients require ICU admissions or upgrades, experience complications, remain hospitalized for extended period of time, or even are readmitted shortly after discharge, healthcare costs increase significantly. These outcomes end up affecting labor costs, critical care expenses, rapid response, technology utilizations, and reimbursement. Sepsis is a good example for this relationship. If sepsis is recognized late, now we have more intensive treatment, we have longer hospital stays, we also have increased resource utilization. But if sepsis was recognized early, then we get to treat them promptly, we give them all the fluids, the antibiotics that are needed, which then improves outcomes and decreases lengths of stay. So, now that we have reviewed the budget and identifying areas to contribute to increase healthcare costs, what I would recommend to an organization leadership relocate resources towards prevention-focused initiatives rather than spending primarily on managing complications after they occur. This is what I'd recommend. One of the biggest opportunities for improvement is investing in staff education along with early intervention strategies. So specifically, I would recommend expanding on the sepsis portion of education programs, including the stimulation-based training opportunities. We would do strengthen quality improvement initiatives, also improving interdisciplinary communication among healthcare team members. As a bedside nurse, I have seen how quickly patients can deteriorate when sepsis develops. Often, the costs associated with treating severe sepsis are much greater than the costs associated with preventing the complications through early recognition and intervention. When sepsis is recognized late, patients require ICU admission, so they end up getting upgraded. They need vasopressor support, they need mechanical ventilation, and prolonged hospitalization. These interventions specifically increase healthcare expenditures and resource utilization. So instead of allocating a larger portion of resources towards treating advanced complications, I believe healthcare organizations should invest more into the early prevention, so the education aspect. Redirecting resources towards the education and patient safety initiatives may help reduce preventable complications, which will decrease ICU utilization, lower the readministration rate, and overall improve patient outcomes. In addition to clinical benefits, these changes may improve financial performance by reducing unnecessary expenditures and improve quality measures. As a result, saving generated from improved patient outcomes could potentially be reinvested into staff development, patient safety initiatives, and other quality improvement programs that continue to benefit both the um, healthcare providers along with patients. So the recommendation of education, I believe there should be a annual like official year where you would have to do a sepsis education and stimulation training program. They could also implement like critical care scenario or like just scenarios that we would talk about. So while there are several areas that could be improved, I believe this initiative would provide the greatest impact on both patient outcomes and organizational finances. The program would include the annual sepsis education, simulation-based training, case studies, and rapid response education. The purpose of these activities would ensure nurses are able to recognize the early signs of sepsis and respond quickly when patient conditions start to change and deteriorate. So I selected this recommendation because sepsis is a condition that I have encountered as bedside, and I have seen it once or twice, especially on the surgical suite floor. When working on this unit, they're recovering from surgery. When they're recovering from surgery, again, they're at increased risk for infection. So I have personally seen how a patient can quickly deteriorate. I had a patient who, for days, people were saying, hey, his blood pressure is what was it? His blood pressure is low, but his heart rate's high. And then on my shift, the switch happened where his blood pressure was high, his heart rate was low. He started to not be able to breathe well, and then he became into that first level of sepsis called a rapid, which is beautiful. However, I wish I had more education in the process of sepsis, so I felt more comfortable saying, hey, something's not right. This could have helped him a tremendous amount, especially with the previous nurses who had him, because if they were to able to identify if sepsis was occurring, we would have stopped it sooner, which would have decreased his length of stay. He wouldn't have to be upgraded to an ICU unit. Although our facility already uses the electronic health record alerts and screening tools because we do have SPOT protocols, technology should not replace the nursing judgment. In this scenario I told you about, there was no SPOT alert. Nurses may still be able to identify subtle changes in patient condition communication concerns to providers and initiate appropriate initiatives and interventions. Education and simulation training can strengthen those skills, increase confidence when responding to the potential sepsis case. Research has also shown that early identification of sepsis can improve outcomes and support faster intervention. By improving staff knowledge and preparedness, the initiative has the potential to reduce mortality, to decrease upgrades, shorten length of stays, improve quality metrics across the organization. So while there would be initial investment on the education training, again, long-term benefit, it would just outweigh the cost. We would be able to improve early recognition and apply interventions rather than increasing their hospital stay and upgrading them and doing more intensive care. So I'm not saying that we shouldn't use the EHR sepsis alerts. Again, they're only to assist. It's more so of us as nurses, we are the first one always there at the scene. We see everything, we notice changes. We should be more aware, more educated on sepsis. So that way we could make sure we get improvement on the initiatives, we get faster interventions, which improves the safety and reduces ultimately the hospital healthcare costs. So the positive implications. So providing the education, providing the simulations, providing case study scenarios, instead of putting it out there for patients to get injured, we do it inside a safe environment. So that way nursing brains can now recognize. So the positivity of this all, it will again reduce upgrades, reduce ICU admissions. It'll reduce the length of stay. It will reduce readmissions because they could leave, become septic, come back. They could reduce sepsis-related complications, and then it will improve the patient satisfaction. On the financial impact of it all, it'll lower the treatment costs because we are no longer having to upgrade to an intensive care unit. They will have less invasive interventions, which will decrease costs as well, which improves reimbursement. This helps with better resource utilization, and then it'll reduce the healthcare expenditures. However, with every up, there's their downs. There's negative financial implications. So the challenges that we face here is the initial expense, staff education, simulation training, education materials, staff time away from patient care, program development costs. These all cost money. So staff education, we have to get someone to educate. We have to get the materials to educate. Simulation training costs a lot of money to rent the rooms, costs a lot of money to get the equipment, to have the coding go in for those simulations. Staff time away from patient care. Nurses cost money. So if we're not at the patient bedside, we're paying for nurses to be education. Some places, unfortunately, might want them more at bedside, rather pay for them to be at bedside rather than to pay for them to go to an education. Additional costs, so there's data monitoring, there's quality improvement tracking, competency assessments, administrative oversight. So all of these are in addition to just us having the initial expense. So we have to monitor, see if these nurses are actually getting the education they need. Are they actually listening? Are they actually remembering what's going on? The assessments will end up costing money as well. So again, with every up, it has its downs. So before policy change can be implemented within the healthcare organization, we have to go through structured review process to ensure that change is evidence-based, feasible, and aligned with the goals of the organization. So the first step is identifying patient safety concern or an area of improvement. In this case, the concern is early sepsis recognition and intervention to reduce complication and improve patient outcomes. Once the problem has been identified, now we go to our next, which is current evidence and practice are reviewed. So this includes examining research studies, national guidelines, recommendations from professional organizations. For the policy that I have chose, I reviewed evidence-related sepsis recognitions, nursing education, simulation training, and quality improvement initiatives. The next step is developing a policy recognition and recommendations and presenting them to leadership. So this may include the nurse managers, directors, the chief nursing officer, quality improvement teams, and other stakeholders who may be involved in the implication. After leadership review, the proposed policy is presented to the appropriate committees for approval. So the committees evaluate the policy, determine whether it aligns with the organization goals, regulatory requirements, patient safety standards, and the available resources. Once it's approved, staff education and training can begin. This is an important step because staff members must understand the policy and feel prepared to apply it in practice. For the policy that I have chosen, this would include the annual sepsis education, simulation training, and then the competency validation. After education is completed, the policy is now implemented throughout the organization. Following implementation, outcomes are monitored and evaluated to determine effectiveness. Metrics such as the sepsis mortality rates, ICU admission upgrades, length of stays, and readmission rates could all be tracked to assess whether the policy is achieving its intended goals. Finally, the policy undergoes ongoing review and revision as needed. So the healthcare is constantly evolving and policies should be updated based on new evidence-based practice. and patient outcomes. So the policy helps ensure that it remains effective and also supports high quality of care. So for the timeline, we have to see if the policy is improved. Policy is improved, awesome. Now we need to see if successful implementation. So during the first 1 or 2 months, primary focus would be on planning. This would include obtaining leadership approval, identifying stakeholders, discussing budget considerations, determining whether resources are needed to support the initiative. During month 3 and 4, we have education materials being developed. We have CES's training modules, simulation scenarios, assessments, educational resources, and staffing. At this stage, unit-based sepsis companions can be identified as well. These individuals can help reinforce education and support staff through the implementation. During months 5 and 6, staff training would begin. Nurses should complete annual sepsis education programs, participate in simulation exercises, and demonstrate competency through evaluations and assessments. This phase is important because it ensures staff members are comfortable recognizing and responding to early sepsis. Beginning at around month 7, around 7, and continuing through the month 12, the policy would be fully implemented by this time. During this time, outcomes would be monitored and evaluated to make sure that there is an effective program. So data such as sepsis, mortality rates, upgrades to ICU, length of stays, readmissions with sepsis can be tracked. So at the end of the first year, leadership and quality improvement could review the results and determine whether additional revisions or improvements are needed on this program. So, for any policy change to be successful, organizations must ensure appropriate resources are available for supporting implementation. While improving sepsis recognition has the potential to improve the outcomes and reduce costs, there are still resources that we need to invest in upfront. So one of the important resources is nurse educators. These individuals would develop training materials, provide education sessions, and help staff understand new expectations. Education is one of the most important components of the initiative because nurses often are the first healthcare professionals to recognize the early signs of sepsis. Simulation equipment and training materials would also be needed. So simulation provides nurses with hand-on experience inside a safe environment, and it gives them those realistic patient scenarios, allowing them to practice their clinical decision-making skills. This type of learning can improve confidence, prepare staff, and help staff quickly respond when patients begin to deteriorate. Quality improvement personnel would also play a critical role. These individuals could assist in monitoring outcomes, tracking compliance, collecting data, evaluating whether the policy is achieving the intended goals. To support these changes, though, certain budget adjustments would be necessary. So this would, like what I would recommend, would increasing the fund on staff education, simulations, and quality improvement programs. While this may increase the cost initially, again, the investments are designed to prevent more expensive with decreased outcomes. So we want to increase patient outcomes. Increased patient outcomes mean a decrease in cost. So over time, I would expect these investments to result in cost saving through reduced ICU utilization, fewer sepsis-related complications, fewer rapid responses, decreased readmission rates, and shorter hospital stays. In other words, the organization would be investing resources upfront with the goal to improve patient outcomes for the long-term financial performance. So, in conclusion, it is important to remember that sepsis is a significant patient safety concern within healthcare organizations. According to CDC, sepsis affects about 1 million of individuals each year and can rapidly progress to organ failure, death, if not recognized early. So the purpose of this project is to analyze how healthcare budgeting can support policy changes and improve patient outcomes. Through this analysis, I was able to identify several categories that we are able to budget on that can directly impact patient outcomes, including staffing costs, critical care expenses, quality improvement expenditures, and reimbursements. My proposed policy focuses on strengthening sepsis recognition through the education simulation-based training and unit sepsis champions, and ongoing monitoring. These recommendations were selected because nurses play a critical role in identifying early signs of patient deterioration and sepsis. We do see them at their baseline, and we could see them further. If we see any changes, we're able to make the call. I also found that investing in prevention and education has the potential to improve both clinical and financial outcomes. Early recognition of sepsis can reduce ICU administrations, decrease length of stay, lower readmission rates, and improve patient safety. So although the implementation requires an initial financial investment, prolonged in the long term, there's more benefits that will value from this initiative. So overall, the project that I have chose demonstrates that healthcare policy, patient outcomes, and financial management are very close connected. Organizations that invest in evidence-based practice and staff development can improve the quality of care while also promoting responsible financial stewardship. So this project has given me a greater appreciation of the relationship between healthcare policy, patient outcomes, and the financial management of it all. The most challenging actually aspect of the assignment was connecting the patient outcomes to financial implications. As a bedside nurse, we often focus on the clinical side of patient care, such as preventing the complications, improving outcomes. However, this project required me to think about, let's see about the financial aspect of it, the influencing staffing costs, the resource utilization, reimbursement, and overall organizational resources. So the aspect of this project, it was identifying the importance of sepsis recognition. Through my nursing practice, I have seen quickly how patients can deteriorate again once sepsis develops. Because this experience, I want to understand more. I want to get educated more. Simulation training, early interventions that could possibly improve patient outcomes. So the most important takeaway is that healthcare policy and financial management are closely connected. Policies don't simply make rules and procedure, they actually directly influence resources and how they are allocated, how to give patient care, and ultimately how patients experience healthcare. So even policies that seem primarily clinical, they can have a significant financial implication for the organization. So this has helped me with my future decision making and encouraged me to consider both the clinical outcomes and the financial outcomes when advocating for change. As a nurse, I want to continue to advocate for the evidence-based practices to improve patient safety. However, now I better understand that when I'm presenting these recommendations, I also have to think about the financial value of the organizational stability. These are the references that I was able to use that supported my budget analysis and policy recommendations. I appreciate you for your time. I do know that this was a longer presentation, but I hope you stayed through the end. Thank you.